Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Surgical management of pain in endometriosis. For surgical management of pain in endometriosis, we do adhesiolysis, fulguration of implants using bipolar cautery, and then excision of the implants, laparoscopic uterine uterosacral nerve ablation, presacral neurectomy, total abdominal hysterectomy, and bilateral salpingo-oophorectomy is done if the family is completed, and it is done in case of new lesions, and this is the last resort. Then
Last resort is total abdominal hysterectomy plus bilateral salpingo-oophorectomy is done. So in surgical treatment, we can do adhesiolysis, fulguration of implants can be done, excision of the implants can be done. Then we can do laparoscopic uterosacral nerve ablation, and also presacral neurectomy is done. Bilateral salpingo-oophorectomy with total abdominal hysterectomy can also be done.
thank you and thank you for watching.